So welcome to this online discussion, everyone. The discussion about social work responses to COVID-19. I understand that already hundreds of people have, more than 250 people have logged into this live stream. Such participation is clearly a testament to the need for discussion and communication between social workers globally. Let me introduce myself. My name is Vasilios Ioakimidis, and I'm the chair of the Interim Education Commission of the International Federation of Social Workers. IFSW, through our commission, is co-hosting today's event with the Social Work Action Network. And the seminar will be focusing, as you expect, on global social work responses to COVID-19. Michael Lavalette will say more about this in a couple of minutes. Now, clearly we're navigating through an extraordinary situation, and extraordinary situations require extraordinary responses. As we speak, social workers, thousands of social workers across the globe are working on the front line, supporting communities. This is an uncharted territory for our profession, and this is why synergies, collaboration, discussions, and solidarity, sharing knowledge is more important than ever. And with this in mind, we're organizing tonight's event. This event is part of a wider range of activities that the International Federation of Social Workers, the Social Work Action Network, our national associations have been engaging with. I would encourage you to visit IFSW's website, and you will read a lot about the extraordinary level of activity our members have been engaging with. You should be also visiting the Social Work Action Network website. At the global level, among other things, IFSW have been providing guidance to its members with regards to ethical dilemmas. At the national levels, a lot of things are happening. For example, the UK, where I'm based at the moment, BASWA have been incredibly active in campaigning for protective equipment, testing of social workers, ethical guidance, etc. Now, without further ado, I would like to introduce our participants. The first participant from Chile is Gianinna Munoz. Gianinna is a social worker and an academic at the Department of Social Work at the University of Chile. Belkin Martinez from Boston is a clinical associate professor at Boston University in the United States, and she's a member of the leadership team of the Boston Liberation Health Group, and is also the author of the book Social Justice in Clinical Practice, a Liberation Health Framework for Social Work. Dora Teloni is an assistant professor at the University of West Attica in Athens, and she's also a founder member of the Greek Social Work Action Network. Filipe Duarte is also with us today. Filipe is an assistant professor in the School of Social Work at the University of Windsor, Canada. He qualified as a social worker in Portugal and completed his PhD in Canada. His work and academic focus lays on the intersection between radical social work and the political economy. Andy Brammer from the UK is a social worker in local government in the north of England. He's also a community activist and an associate lecturer at Sheffield Hallam University. Jesie Yasmin Turton is a social worker, a long-term community activist, and a social work lecturer at the University of Johannesburg at the Department of Social Work. Raed Amira from Palestine. He's the Asia Pacific representative on IFSW Human Rights Commission. He's the coordinator of public and international relations of the Palestinian Union of Social Workers and Psychologists. And Michael Lavalette is the national coordinator of the Social Work Action Network and professor of social work at Liverpool Hope University. So I'd like to pass on to Mike Lavalette, who would explain a little bit more about the topic and how tonight's event would work.
First thing to say is that we want to make this as interactive as possible. And so we would like to encourage you to send in questions on the Swan Facebook page, and we will feed those in later. So we're going to ask all our contributors to say a few words for 5 minutes each. And then for the last 30 minutes of this meeting, we will be taking questions from you around the globe. The other thing we would like you to do, if at all possible, is to like, but also to share this on your own Facebook page so that we can get as broad a reach as possible. So a little bit about the background. We know about the background to COVID-19, but we wanted to put this in a slightly broader background. A few years ago, Vasilios and myself were involved in editing a book called Social Work in Extremis. And the book looked at a number of crisis situations, disasters, political, economic, social, environmental disasters or crises. And we looked at what the various governmental and social work responses were in those situations. And we tried to draw on two works, really. The first one was the work of Naomi Klein and her shock doctrine. And one of the lessons that Naomi Klein emphasised really was that at times of social distress, if we're not careful, the powerful and the elites can move to privatise, can move to roll their interests into the public sector, can move in a way which increases the power of the state, which in long term can inflict on our human rights as citizens. So on the one hand, there is the problem of the shock doctrine, and where that can take societies. But there was another very important work for us, and that was the work of Rebecca Solnit. And Rebecca Solnit drew on the concept of what she described as paradise built in hell. And in Rebecca's work, she looked at a number of studies from around the world in disaster situations where communities came together, and in those circumstances, in those dreadful circumstances, we started to see a slight glimpse of a better world, of a paradise, or the possibility of what world would be like. And that involved quite dynamic. So what we are hoping to get tonight from each of the speakers is an update on what is happening with the COVID crisis in their country, what public services are doing in their country and what social workers are doing, but also are there any mutual aid projects developing, new innovative social work practices that we can all learn from. So that's what we're hoping that the speakers will introduce to us, and then through your questions we will try to explore those issues in more detail. So without further ado, I'm now going to hand over to our first speaker, and that's Gianinna from Chile, sorry.
I can't hear anything. I don't know if anything's up there.
I cannot hear.
I can't hear if anybody's in there.
Okay, I think it's back to me at the moment, and we're trying to sort Gianinna out. Maybe what we should do is that if we move on, so we'll try and come back to Gianinna in a minute or two, see if Gianinna can get her microphone fixed out. But if we now move towards Dawn, maybe Dawn could move up the list. So if I could invite Dawn in to say a few words, that might be the way to go. And then we'll come back to Gianinna in a minute or two. So.
Okay, thank you, Michaels and Vasilios, for organizing this event. Can you hear me? Yeah. As of today, in the United States, there are over 250,000 people who have been diagnosed with the coronavirus, more cases than any other country in the world, and with more than 1,000 deaths yesterday. The federal government's response to this crisis under our for-profit healthcare system has been nothing less than appalling and horrific. There are practically no national responses per se. Rather, each state or city is left to make its own rules and policies. For example, in New York, where my elderly parents live, the city is on lockdown and people can only go out for exercise or to buy food. In contrast, in Arizona, 2 days ago, the golf courses and the gun stores were still open. In Boston, the city is building heated tents for people experiencing homelessness. And in Las Vegas, Nevada, the city is turning a parking lot into a so-called shelter by painting white lines on the ground, 6 feet apart. So people are sleeping in a parking lot where there are over 100,000 hotel rooms unused. Again, there's limited coordinated effort for communities to obtain supplies or protective equipment. The most outrageous example I read about was 2 days ago when the governor of New York went on television and described a bidding war between states for ventilators, and actually said trying to procure ventilators was like bidding on items for eBay. You just keep seeing the prices go up and up. So that's the situation in the United States. Social workers, like all workers, are undergoing enormous challenges. Some of us have been laid off and are living with economic insecurity. There are those that are considered essential workers and are going into work and having to work and cope with the crisis on the ground. Many social workers are working at home and providing services through telehealth, phone, Zoom, email. And working at home can be very challenging during this crisis because it's like no other. Our clients are in desperate need, and you are doing your best to help them with all that you have to do. For example, when I work at home, my 32-year-old son is not here. He lives in his own apartment, right? That's very different from my colleague who I talked to last night, who has 2 young children at home, trying to teach her classes on Zoom and having to homeschool her children. During this crisis, there are enormous creative direct actions that social workers are involved in. I've grouped them into 3 categories. The first one is mutual aid. There's a strong mutual aid movement that social workers are heavily involved in. Many of my colleagues are involved in neighborhood mutual aid processes, and there's also national and constituency-based mutual aids. The 2 big mutual aid projects going on are food delivery, right? If people don't have food, they can't get out, and then financial support. This is crucial, especially for anyone that's employed through what we in the United States call the gig economy. And there's political organizing. We are making a whole series of demands for states, for cities to make changes, and we have to be very creative given the physical distancing that we need to do. These are some of the demands that we're making. That healthcare system and treatment for the coronavirus and related illnesses should be made available to all people with no exceptions. That the government must subordinate the private healthcare system to the need to fight the epidemic, nationalizing healthcare institutions if necessary. The government must take immediate steps to release confined people who are unable to practice social distancing. This includes prisoners, detained individuals, etc. The government must provide ongoing economic relief to all working people who have lost their jobs as a result of the present crisis. This includes cash payments, debt relief, no evictions, rent and mortgage freezes, etc. The government should not interfere or permit corporations to interfere with the activities of labor unions and community organizations working to protect and defend workers who continue to work during the present crisis. And finally, the government must not use the present crisis to fan the flames of xenophobia or to wage war on immigrant populations. And finally, we're very involved in the United States in direct service. The Boston Liberation Health Group believes in the face of this crisis, social workers that do counseling or case management have an important role to play, to offer immediate responses to alleviate the suffering of those affected by the crisis, to ally with our clients and all people struggling to name the oppressive systems like racial capitalism and classism that are hurting them, to explore the causal role in the present crisis, and to raise up the fundamental demand, another world is possible, and to dedicate ourselves to bringing it into being.
Thank you very much, Dawn. It was really, really interesting. Before I invite Gianinna to speak about Chile, can I remind people in the audience to start, if they have any questions, to type the questions on Facebook. So in the second part of this discussion, we can ask those questions of our participants. So Gianinna, would you like to say a few things about the situation in Chile?
thank you very much for inviting me to this event. I think it's very important to be together and
I'm sorry, dear. I'm sorry, dear. We cannot hear you. We cannot hear you. We don't know what is the problem.
Okay, so we're still having problems with Gianinna. We will come back to her, but what we'll do is we'll now move on to Dora, and what the situation is like in Greece, and we'll keep on trying in the background to make sure that we can get through to Chile. So if Dora's ready, we'll move on to your contribution.
Hello, everyone. Can you hear me? Okay. Thank you for the invitation. This is very important, and I think it's a marvelous idea and will give us the opportunity to be aware what's happening across the globe. I will start firstly to try to answer to the first question about the situation in my country. At the moment, there are 1,560 confirmed cases and about 57 dead people until today. The social distancing measures have been put at least 2 weeks before, so we hope that the situation will not be so bad in Greece. But actually, there are practically about 10 days that people need to go, that we need to get permission in order to get out of our houses. Streets are empty and everything is closed down. Still, the proceeding month is crucial, and we're waiting to see how the pandemic will go. So one of the major issues is the fact that the public hospitals are understaffed, while there is also lack of protective equipment, as well as a lack of intensive care units. A number of unions here in Greece have raised these issues, and there are repeated press releases by the Union of Hospital Doctors in Greece about the need to hire permanent staff in the hospitals. It's an irony, of course, that some months before the burst out of the pandemic, the Greek government promoted the privatization of the public hospitals. However, at the moment, every person across Greece has put our hope to the hospitals, to the public ones. In general, there is not only lack of health professionals, but also the public social services are understaffed, while there is also a minimum welfare provision. Of course, the abandonment of the health and welfare sector is not only a result of the financial crisis that hit the Greece during the last decade, but also we need to be aware that it's a result of the neoliberal policies which have been applied in Greece the last decades and promote the privatization of these sectors. So I think that clapping doctors, of course, nurses and social workers, it's not enough. We need strong public health systems. Another big issue is the cover of the needs of the most deprived parts of the population, such as homeless people, Roma, but also the refugee population, which is actually prisoned in the hot centers, in the hot spots, in the islands, in awful conditions. To just refer to Moria camp in Lesbos, there are about 20,000 people that have limited access to toilets and water. So this is a crime. And of course, prisoners that cannot keep social distancing. So what is happening with social work? In this already weakened welfare sector, and given the understaffed social services, still social workers are in the front line providing social support to the most vulnerable parts of the population. In many cases with minimum protective equipment, but also with minimum welfare provision and social services by the state. Can you hear me, please? Okay.
Yes, yes, I agree.
Okay,
Yes.
because I just received a message. I think that it's important to make more visible social work and social work responses across the globe, because at least in Greece, although social workers provide valuable social support, this is not apparent in public discourse. I choose a photo that I will try to show you now. This is the PI, the Help in Home project. Hopefully you can see that. This is by the Helping Home project in the municipality in Veria in North Greece. The staff go door to door to people in need, and particularly to the poorest parts of the population, the most vulnerable ones, and provide social support. They write in their banners, "We are not staying home. We are the Helping Home project." However, there are a lot of problems that social workers face across Greece. In some other Helping Home projects, a colleague of me just sent me the press release of their union that they say they're unpaid for many months, and at the same time they have no protective equipment. These kind of problems face a lot of social workers across Greece. And for example, another example is that in some hospitals, social workers were used to the triage of the patients, and Greek Association of Social Workers have already advocated for their rights, and they try to press the government to protect social workers. So there are a lot of issues for social workers in Greece, and I think that the photo that I show you is one of the more representative ones from Greece, and we need to find ways to support and express our gratitude to our colleagues, but also we need to find ways to make their voice to be heard and support them. And finally, I'm gonna show you some interesting mutual aid and social movement responses that might involve, that I think can inspire social work, and also it's an opportunity for social workers to be connected with these initiatives. I have a lot of them, but I only choose two in order to be okay with the time. So the first one, I will now do again, share screen. Sorry, just a minute. You can probably see that. It's a group in Moria camp. It's run by refugees. It's called Moria Corona Awareness Team. And this is a group of people in Lesbos, in Moria camp, that who are organized, and they are trying to face the coronavirus. They are cooperating with Greeks and organizations, and they are self-organized in order to help the refugees inside the camp. This is the one case that I want to show you. This is very important. It's run by refugees, it's run by teachers, pharmacists, and other professionals that are inside the camp. And another one, example that I would like to show you is this one. It's called the Zero Tolerance Movement. It's for the emancipation of the disabled people. And during the coronavirus, this movement provides solidarity in practice through their activity. Actually, they follow three specific steps. They firstly register, they record the needs and the demands of the disabled people across Greece. Then they raise awareness about these issues. And finally, they will try to provide support to people that are isolated and disabled people around Greece through their network and coalitions. I think that these are some examples that can give us hope for the coalition of social work with the movements and the user movements as well. So that's it for me. Thank you. Thank you.
Dora, I think one of the really important things about the COVID-19 is that governments have moved to distancing and social distancing and physical distancing. And that's obviously very, very important to stop the spread of the virus. But as social workers, it's also important that we try to draw the social and the collective, and that we don't let social distancing or physical distancing become social isolation in our communities and in our homes. And I think Dora gave us some examples there. Our next speaker is Filipe. Filipe, originally from Portugal, now in Canada, but he's going to give us some background in what is happening in Portugal.
Can you hear me? Yes? Okay. So I want to just thank the Social Work Action Network and the IFSW Education Commission for inviting me. I just want to acknowledge that I'm in Canada, even though I'm speaking about Portugal. I hope I can speak on behalf of my colleagues. The Portuguese Association of Social Workers is doing an amazing job. They are social workers that are coming together through social media, WhatsApp, Facebook groups. They are also supporting colleagues working in long-term care in health services. Portugal is run now by a socialist government supported by a minority government backed by the left bloc and the Communist Party. So Portugal is doing actually great. It's ranking now in 15, 16 in terms of COVID-19 cases. So far, around 9,000 confirmed cases, but the measures implemented 2 weeks ago are showing like Portugal, the rate is going down, and that means that Portugal was struggling with the financial crisis between 2008 and 2014. So now social workers are struggling to support not only colleagues, but also the service users and the people in long-term care facilities. They are struggling with coping with anxiety, trauma. But the Portuguese Association 2 weeks ago sent letters to the Portuguese government, to the social security services, and also created an informal support groups across the different regions in Portugal. So I think social workers are doing great as much as they can. My concerns are about the lack of protective support. What I heard from colleagues in the mainland, Portuguese mainland, are just we can self-isolate. We can so people are coming together, creating a different ways of intervening with the older adults on one hand, people with disability, but it's difficult. It's difficult, and so the Portuguese government just also granted citizenship status for all asylum claimants, refugees, and people that were waiting for an immigration citizenship and status. So the Portuguese government is implementing measures. Yesterday, they just renewed the emergency measures, and while people are being laid off, and so I think the unions are not are being shut down, because the problems are the legislation that was implemented as a result of the emergency package was just to reduce or try to avoid just negotiations with the unions. But that's a big problem for the social workers and for the temporary workers in Portugal. So the Portuguese middle class struggling already with the lower wages. So the social workers are not only supporting service users, but also on the other hand are concerned with the schools that were shut down, the societies in lockdown. So I think social work in Portugal is doing an amazing job. And the Portuguese Association is coming together with different colleagues from universities. I think they created a pool of volunteers, social work students that can also support non-profit agencies and try to help frontline workers. On the other hand, for example, in Lisbon, a very well-known agency is trying to support homelessness people at night, coming together and trying to educate people as well to continue supporting the most vulnerable. Okay, so thank you again.
Thank you very much, Filipe. Actually, that was a very interesting presentation focusing on the importance of national associations and trade unions and how we can create those important alliances between our professional associations and social movements. Thank you very much. I would like to invite Andrew Brammer, our next speaker from the UK now.
Okay. First of all, thank you for organising this forum, and thank you for organising me to speak. The first thing that I'd like to report on what the situation is in the United Kingdom in terms of infection rates of death. So we don't know how many people are infected, and the government's been very slow in introducing the measures for testing people, although because of public pressure, it's now having to respond to that. We're currently at around about 3,000 deaths, and those deaths are climbing daily. We're currently around 550 plus deaths per day, and we're aware that we haven't, reached our peak by any stretch of the imagination. I just want to talk about some of the issues about how we've got into this situation. Firstly, I think we've got a government in this country, very much like they have in America, that has denied what was going on and has not learnt the lessons from other countries. Only a few weeks ago, the Prime Minister was boasting about being willing to shake hands with people. And so there's been a lot of misinformation, and that I think has led to a lot of mistrust, particularly amongst public sector workers, about the advice that now comes out from government, particularly about issues like protective equipment for people like social workers who are in the front line, because it shifts on a daily basis from you don't need this equipment to shifting towards a position where it's essential equipment. The second thing I want to say is that why did we get into this situation? Well, we've been told for a long time that public services weren't that important, that the privatisation and the marketisation of public services was desirable and would lead to things running much better. And after 10 plus years of austerity, we've been cut back, to the bone. So all public services who have become central in a lot of ways to the response to what's going on at the moment are not in a position that they should have been to respond to such a crisis. And finally, the way in which social work has gone in public services has moved away from professionally led decision making towards a top-down target managerialism, which doesn't trust the decisions of people on the front line. So I think that is a lot of what has kind of led to the situation that we're in at the moment. So what are the kind of issues that we're facing? I suppose the issues that we are facing are very similar to the issues that you're facing everywhere. In the first few weeks is to make sure that we protect people, we get people the right information across society to make the right decisions about keeping themselves safe. We keep the right services running to keep people safe, and we ensure that people have the right resources to do that. Very interestingly, we've moved very much from a free market economy in this country to almost like a war-like command economy that is requisitioning resources left, right, and centre, and centralising decision making to be able to, respond, to the crisis. There's been a fantastic, I think the most moving thing is the response of society, is that lots and lots of self-organised groups that were maybe there before doing different things have burst into life and are fighting to get, keep people safe from making sure there's food, water, medicines and all those things getting to people. And the voluntary sector has played a key part in that. And social work ourselves are trying to rapidly reorganise into new ways of working to respond to the situation that we've got. And I think that what that has required is what social workers do best, which is to try and understand the situation in its broadest terms, from individual psychology right through to how communities work and how resources, economic resources are distributed. I think the thing is, and I think what the important thing that we remember in terms of our ethics and values is that those cannot go during this crisis. Some of the emergency legislation that's being pushed through by our government is in danger of making the dual mistake of, because I work in the world of mental health and mental capacity and human rights law, we've got to be very careful that the laws that come in don't sweep aside people's human rights around issues like detention and deprivation of liberty. And we also need to be careful, on the other hand, that the laws around like the Care Act that we have for most vulnerable people are not diminished to such an extent. And that is then the emergency powers to be used to deny people. So we need to make sure that the most vulnerable are not denied in this situation, and that there's not mass incarceration without the, human rights as well. From a workers' point of view, and I think it's an issue that exists across society, I think workers are very concerned that the message coming from government is not getting through to organisations. So, for instance, workers who could work remotely via electronic equipment, and social workers are still being expected to go into, in many areas, crowded buildings, creating the problems of cross infection. We've been given advice about the use of personal protective equipment, which is not based on science, but is based on availability of that equipment. And you've probably seen the scenes in the hospitals where our health workers in the front line, are having to beg, steal, and borrow, and in some cases make their own equipment to try and keep them, to try and keep themselves safe. And one of the reasons why I welcome this discussion that we're having today is because what's becoming apparent in this is that the people that we considered important before, not we, but in the media and society, investment bankers and footballers and those kind of people, they're not the important people. The important people are the care workers, are the transport workers, are the people distributing food, working in the warehouses, in the supermarkets, and social workers as well, who are attempting at this moment in time, in very stressful and difficult circumstances, they're trying to rethink working a new paradigm. And that's very, one of the reasons why I welcomed this was having talked to people who have worked in other countries, who have worked in situations where they don't have a national health service and a welfare state and some of the things that we have. We're learning those lessons of how to work in extreme circumstances. Thanks, and I'll leave it there.
A couple of things just before we move on to Jess. I just wanted to share with people that we have at present on Facebook close to 650 people online. We're also getting information that there are a number of Zoom parties. I'm not quite sure I know what those are, but there's a couple of Zoom parties across the world. So it looks as if there are well over 1,000 social workers on the line taking part in the discussion. And we're starting to get questions in as well. So thanks very much for that. Please keep those questions coming. And can I ask you, please, that when you send in your questions, tell us which part of the world that you're coming from, and we will relay that. Andy's contribution, I think, highlighted the importance of politics in the present situation. Certainly in Britain, we are told that we should keep politics aside at this present time, that we should all just work in the national interest, whatever that means. But of course, politics is absolutely vital. It's a political response of the government in Britain or of Trump in America that are shaping the responses and actually putting people's lives on the line through history of austerity or cuts or privatisation and the consequences. So very important questions about the political context within which this is taking place. So I'm now going to move over and invite Jess in to give us a perspective from South Africa.
Thank you very much. Thanks very much. I'm not sure if you can hear me. Can you hear? Thank you very much. Thanks very much to Swan for this initiative. I think the one thing the coronavirus has taught us is that we are linked together as a world. And so from South Africa, I'm really, really appreciating to be part of this. I think in South Africa, we have actually entered quite late into the whole COVID-19. If we look at about 50, on the 15th of March, that's about 2 weeks ago, government made the first announcement about when the first infections were announced. And in fact, since then, we have had, as of today, 1,325 infections and 5 deaths. By last week, government announced a lockdown, a 21-day lockdown. We are just into the first week of the lockdown. there have been quite a lot of criticisms towards government about how they in fact initiated the lockdown, and that in fact in considering it, it hasn't been a pro-poor response to even consider how people who are living in informal settlements, living in townships where that are densely populated, how they in fact can even begin to look at social distancing, never mind everything else. However, government has acted. And in fact, a number of things is happening at the moment. During the lockdown, they are beginning to roll out screening and testing. They've created a solidarity fund that's going to be looking at how to contain the virus, looking at how to support small businesses in the country, and so on. Another very important aspect was the issue of social grants was paid out earlier. This is very important in South Africa. We have 18 million recipients of social grants. So that was quite an important move, I think. So we also have heard that government has introduced food distribution schemes throughout the country. We're not yet sure how it's working, and as civil society, we're monitoring that. The homeless also, there's been attempts to try to find some kind of temporary accommodation for the homeless. But of course, the contradiction is just today within informal settlements in KwaZulu-Natal, one of the provinces, shacks have been demolished by the police. So we have those contradictions that we face, but government has taken some actions, and that should be acknowledged. From a social work point of view, there hasn't been much communication about what social work as an organized entity is doing. And so the sense that one gets is that because the lockdown came very suddenly, and the lockdown means that nobody's working, everybody's locked into their homes, only essential services are going out there, that a lot of social workers might be offering services from their homes, maybe through teleservices, etc. It's not clear, it's not clearly communicated what's happening. Social workers who work for the state have, in fact, they are on standby as essential services. The social work, the statutory body, which is called the Council for Social Service Professionals, have put out some communication and giving guidelines for what social workers can do during this time. And the message very much is working remotely, working from home, and seeing how we can find other ways to provide services to communities. A very interesting point the council mentioned was that social workers should engage in advocacy and awareness raising around the pandemic and find ways to have communities participate during this time. It's a very interesting point because I think just historically, social work in South Africa has not played a very prominent role. And so we will see how this unfolds in the next couple of weeks, and hoping that, in fact, social workers can play a more proactive role. With regard to social movements, South Africa's got a very rich and vibrant civil society. And as soon as the president announced the lockdown, social movements got together. And at the moment, we have about 160 organizations, social movements, NGOs, CBOs, the trade union movements, workers' organizations, refugee migrant communities, some academic institutions, who have all got together under the banner of, we're calling it the People's Coalition. And they've put forward a program of action that is saying to government, we need you as government to look at certain things. And some of the demands are that every household should have food and access to food. In South Africa, there are high levels of food inequality and food insecurity. And so this is a very critical point. The other is that the homeless should be sheltered. One of the other key issues that the People's Coalition have pointed out is the issue around income security for all. We have about 10 million people in the country who are between the ages of 18 and 59, and who in fact don't qualify for the social grants. They don't meet the criteria for the social grants. They're unemployed people. And so they have absolutely no form of income. So we are repeating this call to government. We have done it before and they didn't accept it for a basic income grant, but we are repeating the call and saying that it is important at this point that the government take emergency measures to ensure income security for all. There are other demands that have come out from the People's Coalition, such as just looking at the gender-based violence. South Africa's got a very high rate of gender-based violence, and how do we get communities and community structures involved in monitoring gender-based violence within the community. The other key issue is, especially with social distancing, that we look at how to have more access to, in being able to communicate, that we have more access to free data. Data in South Africa is very, very expensive. And so if we're going to find some way to communicate, we need to have more access to data. And then the last thing is that with the army out on the streets now and trying to control communities within the lockdown, one of the issues that has been raised by the People's Coalition is that we have to prevent this authoritarian and security-focused approach to the lockdown. And we have to work, and that we're calling on the authorities to work with social movements at the moment so that we can collectively ensure that care and resources are provided to our communities in a much more collective way. I think it's a pity, and in fact, maybe it's an international trend, that social workers are, as a rule, not involved in social movements. So last week, a call was made within the ASASWE, it's the Association of South African Social Work Education Institutions. A call was made through them to say that it's so important that social work bodies link up with the social movements and that link up with the national campaigns which have been initiated at the moment in the country. I don't think it's a time for social workers to be operating independently. And I also think that it's important that social workers join in collective action and solidarity as we navigate this very, very difficult time about how we can best meet the needs of the most vulnerable communities in our country. And I think the call really is that social workers should join the movements, because there isn't a coherent social workers movement in this country that is leading or that is coming out with a really comprehensive program. And so I think for social workers in South Africa to join the social movement is what really is an important call at the moment. I'm going to stop there, and maybe there'll be time for questions later. Thank you.
Thank you very much, Giles. Actually, it was very interesting that in your brief presentation, you highlighted a very important issue that has come up, I can see also in some of the comments and questions. The issue of advocacy and collective responses, because what has come up out of this pandemic as well is reinforcement sometimes from governments and states, a reinforcement of on individualism, saying that it's the individual responsibility to take care of themselves. People who go outside or engage with activities, or they're not careful, they're irresponsible. Whereas, as we know, people, not everyone has the privilege or the luxury of living in big houses and in accommodation that allows distancing. So it was very good that you highlight this, and you also highlight the importance of collectivizing our responses instead of individualizing responses. So I would like to invite Gianinna from Chile. Let's see if the sound problems have been resolved. Gianinna.
Can you hear me now?
Yes.
Can you hear me now?
Oh, yes, yes.
Oh, great. Thank you very much for inviting me. And yes, I'm happy that now I can speak to you. This has been a very critical situation, so I'm very glad we have this kind of forum or event to discuss all together. I think we are all affected in different ways, but we are all affected. In Chile, we have had more than 3,400 people infected since the 3rd of March, when the first case was detected. Unfortunately, 18 people have died in these 3 or 4 weeks. There has been many problems related to the detection of the infection. For example, diagnosis take time, even more than 6 days in some cases, and there is a lack of resources in hospitals to deal with both diagnosis and treatment. And more broadly, it has been detected that there is a lack of transparency in decisions taken by the government. For example, economy is being protected more than people's lives, of course, and diverse measures that remember us the shock doctrine, as Michael reminded us at the beginning of this forum, that has been taken by the government. For example, this week, the private health system has increased the fee we have to pay every month to have access to health services. And last week, the government was proposing laws to protect the employment that aim to protect companies rather than workers. Workers, for example, might not receive salary if they don't go to work during the lockdown or the quarantine days. So we can see clearly how this shock doctrine is working every day in our country. We also have observed a lack of coherence, a kind of absence of the state action. For example, there is no policy for quarantine or lockdown. Every city council is making their decisions. There is not a national policy protecting people. All this indicates that this apparent no policy of the government is indeed the policy. This health crisis related to coronavirus today is a result of the weaknesses of the democratic nature of the Chilean system. This is what has been the core of protests and political outbreak occurring in my country since October last year, when the revolt against neoliberal model started in the streets and has been stopped at the moment for now as a result of this sanitary crisis. What about social workers? Most social workers are working from home over these two last weeks, but also there are some social workers that are still working in hospitals, risking their own lives, working on domestic violence, which has increased in time of lockdown and quarantine, working with migrant people and homeless people and related housing problems. And what is more, most social workers who are working at hospitals do not have a mask or even soap to wash their hands. It's terrible, but it's something that is happening. About the actions, I can say that the National Association of Social Workers has denounced these situations and is working in a joint action with the National Federation of Professional Association of Chile, doing many things, appearing in social media, publishing statements, and coordinating social organizations in diverse cities of Chile, organizing a political discourse in these critical times. The National Association of Social Workers is currently denouncing that it is time not only to address coronavirus in an effective way, but also to rethink our health system and, of course, our model of development that we inherit by the dictatorship of Pinochet, and which is we have been questioning during the protest since last year. Also, the association is demanding the government to undertake policies that protect people and denouncing the reinforcement of neoliberal policies as what I already commented, on employment and in health fees and so on. The association is also educating people under the belief that government is not going to protect us. We have to look after us as a community. And in this sense, is creating new senses of the life we want to have. It is time to think, to engage again with our communities. This is the call that the association has been made over these last weeks. Connecting from affection, solidarity again. I think we have a long way to walk still, because the revolt, the social and political outbreak that we had in October until January, is still ongoing, despite the crisis, despite all this time at home. Many organizations is connecting each other around with this kind of platforms like Zoom or Skype or I don't know, different virtual spaces to connect and get the strength enough to continue with the demands. Well, I think we can have time for questions now, but thank you very much for having me.
Thank you very much, Gianinna. That was very interesting. And actually, Chile has been, as we know, a case study for neoliberalism. And several years, decades of privatization and marketization do have an impact on how the government and society deals with the current pandemic. The next speaker is Raed Amira from Palestine. Palestine, again, is a very particular case. See, the term lockdown has entered our international lexicon as part of the pandemic, but Palestine has been experiencing a lockdown due to the occupation for decades. So it would be very interesting to hear from Raed, how are social workers coping with the situation, a crisis within a crisis, really. So, Raed.
Hello, everyone, and thank you for the invitation from me. In the name of Palestine, we wish everyone safe. The health situation in Palestine is like the rest of the world, and as you know, the privacy of Palestine is the general health situation and provides the capabilities and the challenges facing the governorate in preventing the spread of this virus. So it is possible to continue the situation in Palestine by closing schools and restrictions imposed on reaching work places, which may lead to an increase in psychological suffering, especially among children. So in addition to the closure of the occupation and the explosion of Palestinian workers, and in some cities, workers on the side of the road who have discovered virus COVID-19 or corona were thrown. This was a racist and unfair behavior. And a group of Israel soldiers spat on cars or shop in recently products video and this criminal behavior. The occupation forces create a state of terror among Palestinian children and society. So the Palestinian government was able to take preventive measures from the date of 6 March, which is the second day that the presence of coronavirus was announced in Bethlehem. And these measures continued to increase until people committed to their homes, and in a very large percentage. This helped to prevent the spread of the epidemic in Bethlehem, as the government closed the cities and spirited from the village in order to limit a movement between people. And as you know, many villages here, it's under the Israeli occupation control, not the Palestinian National Authority. So about Gaza, in Gaza, those arriving from Egypt and the workers from inside were spirited for 14 days, which also helped prevent the spread of the virus. About social worker or the information of emergency committees in Area C that are part of Israel occupation, as I told you before, help the Palestinian government in measures to limit the spread of the virus. As emergency committees and volunteers were able to establish security barriers in its village in order to limit movement in coordination with the government. The Palestinian Security Services and the Palestinian Ministry of Health, these were the initiative has an impact on helping people. The social worker here in Palestine participate in the emergency committee here in Palestine, in the village and the camps and the cities, and with the governorate in Palestine. So the role that social workers play, really it's an amazing job today in parallel with the emergency committee with the view. First of all, the Palestinian Union of Social Workers and Psychologists, on behalf of our General Secretary, established psychological support program for all branches in West Bank and Jerusalem and Gaza to help and support the people and the governorate or the government. So raise awareness or supporting the local committee along with the other emergency event and raising awareness of the coronavirus. Raise awareness among the Palestinian community of the importance of strengthening family relations, especially with the children. Support workers in the field from the security services and medical staff or our doctors, and communicating with them through field visits or through the hotline. Established a free hotline for beneficiaries to communicate with the psychological support and social support team in all governorates, West Bank, Jerusalem, and Gaza. Participate and contribute to providing chronic medicine and food aid to needy family, especially in the camps and our village. It's named Area C. Area C, that's mean under the Israeli occupation. So when we close this area or the village from the Israel situation, the Israel occupation, so he cannot find anything to eat or to do something. Social workers here in Palestine have received before 2 weeks 100 calls from Palestinian families and have been dealt with all of them, in addition to daily meeting by radio station in all cities of Palestinian, and today they are official daily program products through meeting in many topics with a group of social workers in here in Palestine. So I want to talk with you about the challenges here in Palestine. First of all, Palestinian workers in 1948. I told you before what happened with the Israeli soldiers. Second, the Palestinian prisoners. Israel refused to release the Palestinian prisoners, especially the children and the women. Really, this is a very, very difficult situation. Our government and our unions and the NGOs demand the Israel government to release our children, the prisoners in the Israel. Third, the occupation is still storming Palestinian cities and camps, and an attempt to thwart the work of the emergency committees. And finally, we have today a plan of action for follow-up with not only the vulnerable people, not only the disabled people, not only for the doctor. We have really it's amazing jobs for the social workers, how we can follow up with the families of the prisoners here in Palestine. Because
sorry for interrupting. I'm also mindful of the time, and I will need to ask you to wrap up.
It's okay. That's it. Thank you very much again.
Thank you very much, Roy.
On time, dear. I am commitment.
That was really, really, really important. I'd like to pass on to Michael, who will. This concluded the first part of today's webinar, with the presentations from all over the world. I think the messages were very clear about the important role of social work. The political dimension. I think all of the speakers highlighted the political dimension of the current pandemic, and now we'll move into asking our speakers with some questions. So I would like to ask Michael to start with the first question.
Okay. Well, thanks very much for all your questions and your comments. I thought I would just start off by reading some of the comments out first of all. So Norby Paul in Kenya has pointed out that the talk about social movements from the various contributors is important because he says in Kenya, it's the social movements who have been taking the initiatives because there have been no clear lead from the professional bodies. Another comment from Michael in the States, and he said that social workers are having to fight to defend abortion rights and facilities because they are being deemed as non-essential services at this point in time. And there's a number of people making comments about the lack of access to water and personal protection equipment. So if you keep the comments coming, keep the questions coming, we'll try to get through them as quickly as we can. So the first question I'm going to ask, how we're going to run this, is that we are going to take one question and identify one of our contributors to answer that. And then after they've answered the question, it will be back to Vasilios, who will ask the second question, and so on. So we're not asking all people to comment on each question. So the first question I'm going to direct to Jesie, if that's okay. And it's from somebody called Darren Wright Snags, and he says, how realistic is the model of social distancing that's being imposed? How realistic is that in some African and Caribbean countries which simply don't have the resources of the rich Western countries?
Can you hear me?
Yep.
Thank you very much for that question. I think the reality of the situation is that social distancing within poor working class communities that are densely populated, as well as informal settlements, is not possible. People live in South Africa, people live, and I'm sure it's the same in Kenya and other parts of the world, where you have large shack settlements. In Alexandra Township, which is a township in South Africa, you will find 10 people living in a 2-meter shack. And so the issue of social distancing is completely unrealistic. I think what we have tried to do, and there are task teams set up in our country at the moment around looking at this, is saying what is the best way that we can say to people within informal settlements or densely populated homes, how do we explain to them what this virus means and what it can do and how? And so the only way to do that, I think, is that you work with community structures, you try and explain to people the dangers of the virus and what it means, and then try to see what precautions they can take. But social distancing within an informal settlement is not realistic. And this is why in our own country, we said that when the president said social distancing, it's a completely anti-poor response. It's not understanding the needs of poor people, the realities of poor people who are living in these shacks. It's okay if you're living in, in middle-class suburbs and so on, where you can actually practice social distancing. But you can't do that in an informal settlement. It's one of the biggest dangers we face at the moment, because we've had our first infections within the informal settlements. And I think our government knows we don't have the health, we don't have the resources to be able to look after people if there's a huge increase in infection. So I know it's not answering the question properly, because the truth is there isn't, unless people are moved out of those settlements and put into other accommodation, which again is not realistic. We face a really big problem. And we have to look at how we work with our local community structures within these communities and try to explain people to just take whatever precautions are possible. Capitalism has created this virus, and I think the issue is we have to find ways to fight it, and it's going to take a lot of collective effort to be able to do that.
Thank you very much, Jess. With regards to comments, I would like to read out a comment that was just sent out from Rory Truell, the General Secretary of the International Federation of Social Workers, and it's really very relevant to what you were just saying, Jess. So Rory says, social work in this crisis is not limited to essential roles of facilitating support systems with people and support of physical distancing. The profession also has an ethical obligation to challenge the structures that have led us to this virus. Poverty, climate change have been widely identified as the root causes. So this crisis, as terrible as it is, also represents opportunities for communities and societies to advance the need for sustainable future. Very relevant to what you were just saying. Next question, I would like to address this question to Dawn from the United States. So Dawn, there's a question about secondary trauma. So what about secondary trauma for those offering services in the front line?
Yes, so that's a really great question, because many social workers in the United States are still in hospitals and experiencing all of the crisis and horrible things that they're seeing and having to witness. So I have a couple of thoughts about that. One is that there's a tremendous amount of mutual aid that's very accessible to people sort of online, so that you can get, there's lots of different sort of the word that's used in the United States is self-care. I prefer the word community care. Community care interventions around managing anxiety, managing any kind of trauma symptoms and things like that. And if we have a really big, large list of different kinds of services that I can actually email to you, Vasilios, and we can put it in the chat or something. So there's that, sort of actual sort of mutual aid, community care services to manage symptoms of trauma. But more importantly than that, and that gets to what Vasilios talked about, and so Rory, which is this is not an individual problem, this is a collective one, right? And so we want to combat the feeling of isolation, that you're in this alone, with solidarity and community. So I would encourage anyone that's experiencing any kind of symptoms of secondary trauma to, of course, utilize community care resources and interventions, but more importantly, hook up with other people that are involved, your fellow social workers. Like in Boston, anyone that's actually anywhere can join our Facebook group for Boston Liberation Health Group, the NASW, and sort of that you're not in this alone, that other people are there with you struggling to create, this better world.
Okay, thanks very much, Dawn. Again, we've had a number of comments all pointing to the political crisis of the present period. So Rudy Roos in Belgium tells us that the crisis needs a much more, highlights the need for social work to become much more political. We've got Tony Staunton in the UK telling us that we'll need to organise to deal with the massive increase in domestic abuse, poverty and unemployment coming out of the crisis. Roberta Ucha in Brazil points out that in Brazil, actually the situation is terrible because the President Bolsonaro refuses to even acknowledge that this is a problem. He thinks it's something that's been made up by the press. And we have Gurnam Singh, who has put a comment in saying that we need to prepare a new social work practice paradigm. But the question that has come in is one that was specific for Andy Brammer in the UK. And this is from George J. And it says, Andy, how has the new COVID legislation in the UK changed the role of social workers?
So if people aren't aware, the British government has moved emergency powers through the Parliament, which it has the option of using at any point now in relation to the corona crisis. I think the two that have been alluded to there are changes to the Care Act, which is how we provide services to vulnerable adults, and changes to our mental health legislation, which is the human rights legislation that protects people in relation to the deprivation of their liberty. And the legislation in relation to the Care Act has, I would say, further reduced people's eligibility to receive services. And the Mental Health Act changes are really to allow us, and I undertake that role, to deprive people of their liberty with less safeguards and longer time limits that were there previously. So that those are on statute but not being used at the moment. But potentially worrying thing about those, that what I said earlier on, is that these can be used to deny services to the most vulnerable, and make it easier for us to detain people without the necessary checklist. But I think the most important thing is to recognise that why are we in this situation where they're having to do that? Well, it's because they have, first of austerity and cuts, they have reduced services to such an extent that this crisis now is meaning that they're going that they are having to look at how they can do justice on the stripped down justice, and looking at how we take services, when actually in a crisis like this it's more important. I mean, I know I keep using war analogies, but the Human Rights Act came out of the Holocaust and what happened during the Second World War. That came out of a crisis in the 1930s of society. And Rory is absolutely right. We can't just look at where we are now. We need to look at how we got here as well. And in as much as so in this moment in time, what we should be arguing for are more resources and more aid and help to people, and not less. And we must guard against the steamrolling over human rights, because just as they do with anti-terrorism legislation, they get it onto the statute book now in a time of crisis, and they will keep it for later, and it won't just be used against the most vulnerable in society. It will be used against our families and our communities who are all already to blame. Austerity and privatization and neoliberalism got us into this mess. I've been asked, what are the lessons when we go back to normality? I don't want to go back to normality. Normality got us into this mess in the first place. In the future, we want a different kind of social work based on the grassroots activism and joint working that we're developing across services at this time. Thank you.
Thank you very much, Andy. There's more and more comments coming and highlight the importance of international solidarity and mention and focus on the fact that a global pandemic clearly cannot be dealt with at the national level. Borders are meaningless when it comes to global issues like this. So I would like to invite Filipe and ask a question from Helena from Cyprus, who asks, how can we mobilize on a global level in order to protect human rights?
It's a really important question for everyone. I think as the IFSW Secretary General have been saying, and the IFSW has been playing a really important role during the pandemic. Can you hear me now? Yeah, okay. So I was just saying that this is $1 million question. I think the question is for everyone here, for all the speakers, all my colleagues. What I was just saying is that so the IFSW Secretary General, Dr. Truel, and the whole global IFSW Commission have been just playing an international role on promoting human rights during the pandemic crisis. So, but this is a really a challenging time. So I think through collectivist values, so ideology, we have seen different approaches in different countries. So, but the political dimension of social work, it's really important at this time. So we were fighting at the end of 2019, climate change, we were fighting different types of human rights. And now we are just trying to promote and advocate for our not only service users on one hand, but the whole society, healthcare workers, people on lower wages, our own profession in Western countries, Portugal, for example, but throughout the Europe, we are just advocating for change. So not only the SDGs now are changing, and the goals that were set up for 2030 in 10 years from now, everything is changing. And I think the political dimension of our profession, our social justice and human rights values have to be just solved through collectivist approaches. And I think it's an important message that IFSW is now changing and promoting and publicly. So I don't have a clear answer, but I hope that the other speakers can join me and answer and contribute to this.
Okay, thanks, Filipe. Again, just a few of the comments. We have had some comments from people just pointing out that at the heart of the present crisis is capitalism and capitalism's impact on the environment and industrial scale farming and the space that creates for viruses to develop. I'm actually going to ask Dora the next question, and it's from a number of different people have raised this issue. So people are raising about, under lockdown, the rise of domestic violence, the possibilities, the way in which some media and some governments are playing communities off against each other. So Dora, as social workers engaged in communities, how do we fight to protect the vulnerable at a time of crisis?
Okay. I think you can hear me. Can you hear me? Yeah. This is a big issue. This is a big problem. Some days before, a woman was killed by her partner in a house. And this is one of the issues that many feminist organizations raise up, because all domestic violence as well to women, but also to children, now all of them are locked in their houses. So I think that we pay the price of not having social services, of not having services for helping people. And of course, now we all pay this price of privatization of services and neoliberal attack in this. Social workers and social services do their best, and they do their best also through these telephone lines. But I think this is not enough. I think that we need to raise up these issues, to address these issues, to make apparent all over the world what is happening. And we need to stand up and demand the services and give the opportunity to people that are locked in their houses to have a helpline and have services and people that can help them effectively. But without that, without resources, and without having this opportunity by our governments and globally, I don't think that many things we can do. I will agree that this is the point that we need to raise up the political dimension of social work, and this is also goes to this kind of problems like domestic violence. And we need to stand up. We need to stand up for the rights of the people in the houses, of the vulnerable people. And the only way, as I can see, to do that is to do that collectively and connect our voice with the voice of the movement, such as the feminist movement and the social movement and the user movements. Hopefully, I respond to this.
Thank you very much, Dora. And actually, your answer is very relevant to the next question I would like to ask. The next question would be for Gianinna, and would like to hear what, in your opinion, Gianinna, what demands should social workers start articulating towards governments with regards to health and social care services?
Thank you, Vasilios. I think, well, this is a very difficult question because in the case of Chile, I think it means to question the whole system, the whole rationality that is behind policies of health and social care. It means to understand that health and social care are not services that can be buy in the market. You know, this is something that is in the very root of the problem. And that means that social workers need to be united, as the other colleagues have said before in their presentations. We cannot do this alone. We need to be organized with other professional bodies, with social movements, with communities, with service users, association or organizations, because this is something that is big enough, too big for us as a profession to fight against. We can take part in a whole process of questioning and thinking again what kind of society we want to have. This means, in the case of Chile specifically, to question the role of the state in providing health, social services, and education, and other services. I think one of the key dimensions of these demands is how to provide this kind of services in a participative way. We have a system which is very, how can I say, patronizing, designed from authorities which are in a very different situation from the communities which are in poverty and excluded from the development. Segregation is too big in Chile, so the politicians, the policymakers who are designing health and social services policies generally don't know what communities need. So I think participation and connection with other organizations is a key point to demand the state and the governments to take another approach on this crisis.
Thanks very much, Gianinna. Now, colleagues, this is going to be the last question. We have directed a question towards each of our contributors. So this question is for Raed. Obviously, around large parts of the globe, people are now effectively in lockdown or in quarantine. And Raed, we wondered whether you could perhaps just briefly give us some examples of how people in Palestine who have got a history of being put under these situations, if we think about the 2003 Intifada in Nablus, people were locked down for 75 days in the trot. So maybe you could talk a little bit about the social isolation and how families and communities overcome that social isolation.
You hear me? You hear me?
Yeah. Yeah.
Okay, thank you. This is a big question, really. This is a big question for Palestinian people, not for the social worker only. Well, yeah. Have, I think after 72 years under the occupation, before that, the first many times the soldiers closed us and attacked our country in 2000 in the second Intifada. So the Palestinian people don't like to talk about that. How we can face this problem.
Okay, we seem to. Okay, we seem to have lost Raed just at that point when he was going to shine some light on what the Palestinian community did and how they responded to the various periods of lockdown that they have been involved in. I'm sure, however, at the next meeting that we will be organising in the next few weeks, we will be able to come back to those kind of questions. I want to draw this evening's meeting to an end now. I want to thank all of you for participating online, through watching, through giving us your comments, through giving us your questions. I want to thank all of our contributors. I think we would all agree that they have been very concise and have really highlighted some of the global issues that have taken place. I'd like to ask you now if you're able to visit both the IFSW website, where there is more information on what social workers internationally are doing, and of course the Swan website, the socialworkfuture.org website is there, and all future meetings and activities will be advertised there. Our next meeting will probably be in a fortnight's time, but please look at the Swan Facebook page where it will be advertised, and we'll let you know from there. Thanks very much for joining us. Please stay safe, stay well. Thank you.